Have you ever woken up in the middle of the night, looked around your quiet room with only the ticking of the clock, and once again made your way to the bathroom? Then returned to bed trying to close your eyes, but sleep feels like it has slipped away. It happens every night. Each trip to the bathroom comes with a sigh. Not out of exhaustion, but because you can feel your body changing, and no one told you this would happen sooner. Some say, it's because you drink too much water. Others laugh it off. That's just getting older. But if deep down you feel like something's not quite right, stay with this video for just a few more minutes. Because I want to tell you about something many men over 60 are quietly going through. Something real. Prostate enlargement. And those nighttime trips to the bathroom? They might just be your body's way of sending you a message. If you've ever quietly wondered, is something wrong with me? Then today's message is for you. And before we begin, I invite you to do 3 small things. Click like if you've ever experienced this. Hit subscribe so health videos from this channel always reach you first. And leave a simple comment, I pee a lot at night, so we all know that you are not alone. 1. What is BPH? Remember those endless nighttime bathroom trips we just talked about? They're not random. It's not just because you drank too much water before bed, like many people think, and it's not simply because that's just aging, as we often shrug off. The truth is, many of those wake-ups in the night are signs of something quietly happening inside a man's body. A slow, silent change that can have a big impact. Prostate enlargement. The prostate, it may sound unfamiliar, but it's been in every man's body since birth. It's located in a very discreet spot, just below the bladder and surrounding the urethra, the tube that carries urine out of the body. When you're young, the prostate is small, about the size of a walnut. But over time, especially after age 50, it tends to grow. A natural process, but not always a harmless one. As it enlarges, the prostate begins to press on the urethra, causing a weaker urine stream, interruptions, incomplete emptying, and especially more frequent urges to urinate, especially at night. Medical professionals call this condition benign prostatic hyperplasia, or BPH. It may sound benign, but if left misunderstood or unmanaged, BPH can significantly impact your quality of life. Disrupted sleep, the anxiety of losing control when out in public, avoiding long trips for fear of sudden bathroom needs, and perhaps the hardest part, feeling exhausted, frustrated, and sleepless, with no clear explanation why. The numbers might surprise you. As of 2019, data from the World Health Organization and international studies show that around 94 million men over age 40 live with an enlarged prostate, and the older you get, the higher the risk. It's estimated that 24% of men aged 75 to 79 are diagnosed with BPH. More strikingly, after age 80, that rate jumps to over 80%. That means 8 out of 10 men over 80 are facing this issue, whether they know it or not. Yet most of us don't pay attention, not because we don't care about our health, but because this condition doesn't cause pain. It just quietly wakes you at night. It doesn't scream or flash warning signs. It simply whispers. Each time you lose sleep, each step you take toward the bathroom while everyone else sleeps peacefully. It's so subtle you might just think, I'm just getting a little older, and go on living with it. But when the inconvenience grows, long nights without rest, challenging travel, and losing confidence in public, that's when you need to start listening more closely to your body. You see, urinating many times at night may not be as simple as it seems. It could be an early warning, a silent message your prostate is trying to send. And if you've ever quietly asked yourself, could I be having a prostate problem? This is the time to start taking that question more seriously. If you've ever thought nighttime urination was just normal, leave a simple comment below. I used to think it was normal. Who knows? Your message might help someone else realize they're not alone. 2. A common symptom, nocturia, frequent nighttime urination. Do you still remember those restless nights when you woke up at least once just to go to the bathroom? When the night was still quiet, but inside you, sleep had vanished? That's the very first and most common sign of what medicine calls nocturia, the need to wake up one or more times during the night to urinate. It's not unheard of, but it's also not something you should just learn to live with. According to the International Continence Society, nocturia is defined as waking up at least once each night solely to urinate, and most people only seek medical help when it happens 2 or more times per night. When that frequency starts to increase, the consequences go far beyond disrupted sleep. It leads to fatigue, reduced focus, daytime stress, and even falls. Epidemiological studies show that among men aged 50 to 70, about 20 to 30% experience nocturia, waking up to urinate greater than or equal to 2 times a night. That number rises to 10 to 50% among those over 70. For people over 60, more than 60% report that their sleep quality is seriously affected by this condition. And for those with BPH, benign prostatic hyperplasia, the situation is even more pronounced. One study on 505 BPH patients showed that 71.1% of them woke at least twice each night to urinate. Another survey revealed that 78.6% of patients complained they were waking up more than they were struggling to fall asleep, meaning their nights are not just about light sleep, but about repeated disruption and more difficulty falling back asleep than ever before. Just imagine, instead of a peaceful, deep sleep, you're repeatedly pulled out of a half-asleep state. Many people say they not only feel exhausted, but also worry they'll never fall back asleep again. One person shared, "It's not just insomnia anymore. It's losing peace every night." And according to studies, 25% of nighttime falls in older adults happen during those late-night walks to the bathroom in the dark. Clearly, urinating many times in the night isn't just a minor inconvenience. It has wide-reaching effects on your physical health, mental well-being, and safety. It's not just lost sleep, it's losing your sense of safety and control in your own bedroom. This is no longer just about getting older. It's a health issue that needs attention. If you've ever found yourself waking up 2 or 3 times each night, leave a comment. I want to break this bad habit so we can begin this journey together toward better sleep and better health. Who knows, your small act of sharing might just help someone out there who's been silently struggling. 3. Treatment approach. Number 1. Lifestyle adjustments. We've talked a lot about restless nights, the feeling of waking up in the middle of the night just because of an unexpected urge to urinate. But when the body speaks up, the important thing is not to panic, it's to take action. And one of the first, simplest, yet most powerful steps is changing your daily habits. If you've been wondering why you're urinating many times in the night, sometimes the answer lies in the small details of everyday life, like that late glass of water after dinner or the habit of drinking strong tea close to bedtime. After age 60, the bladder becomes more sensitive, and any extra fluids will be processed by your body, even while you sleep. That's why experts recommend reducing your fluid intake 2 to 3 hours before going to bed. It's a small adjustment, but it helps keep your bladder from waking you up at midnight. Also, pay attention to what you drink. Coffee, tea, alcohol, all are stimulants that can make your bladder wake up before you do. That small glass of wine in the evening might seem relaxing, but in reality, it often leads to more nighttime trips to the bathroom. So cutting back on these beverages in the late afternoon and evening doesn't just protect your sleep, it helps your body better manage urine production overnight. And did you know? Beyond diet, training your pelvic floor muscles, known as Kegel exercises, has been confirmed by experts at Harvard and the Mayo Clinic as an effective method for managing urinary issues. These simple exercises, which you can do right from your bed, strengthen bladder control and reduce sudden urges to go. Many studies have shown that regular pelvic floor training not only improves urinary function, but also boosts confidence and reduces stress, especially for those dealing with BPH symptoms. Of course, every body is on its own journey. Some may notice a real difference after just a few weeks of adjustments. Others may take longer. But what matters most is this: you're being proactive. You're choosing change instead of waiting passively. And if you're already taking small steps to reduce nighttime urination, leave a message below this video. I'm taking small steps to sleep better. It's a way to mark your journey and to encourage others who are walking a similar path. 4. Treatment approach number 2. Medication lifestyle changes are a great starting point. It's like tidying up your room, removing what's unnecessary to make the space more livable. But for many people, especially when nighttime urination becomes prolonged and seriously affects sleep. Lifestyle adjustments alone aren't enough. That's when the body may need more direct support from medication. As you now know, frequent nighttime urination is closely linked to prostate enlargement. When the prostate grows, it presses against the urethra, weakening the urine stream and forcing the bladder to work harder. The first group of medications doctors typically prescribe in this case are those that relax the muscles around the prostate, called alpha blockers. Familiar names like tamsulosin, silodosin, and terazosin have been shown to relax the smooth muscle around the prostate, thereby improving urine flow significantly. However, simply relaxing the muscles doesn't reduce the size of the prostate. For cases where the gland is already noticeably enlarged, a second group of medications, called 5-alpha reductase inhibitors, such as finasteride, is considered. These drugs work by blocking the hormone responsible for prostate growth, helping to shrink the gland over time. The result? Reduced pressure on the urinary tract and improved nighttime urination and incomplete voiding. The effectiveness of these medications isn't just talk. A clinical study found that tamsulosin reduced nighttime urination frequency by an average of 17.9%, while prostate surgery like TURP, when needed, can improve nighttime urination by up to 32.2%. These numbers show that when used correctly, medication is a key part of the BPH treatment journey. Of course, like all medical treatments, medications must be used under clear guidance from a physician. Some people may experience side effects like dizziness or a sudden drop in blood pressure upon standing, or, depending on the type, sexual dysfunction. But the important thing is, these reactions can be managed when caught early and properly adjusted. Not everyone will experience them, but everyone should be aware, so you can approach treatment with clarity, not anxiety. In the end, medication isn't something to fear. It's a tool, a walking stick, when your body needs a bit of support to regain balance. And like any tool, its value lies in how we use it. If you've taken medication for prostate enlargement or are considering starting, leave a comment. I believe treatment should go in the right direction. Because when you share, you're not just expressing your belief, you're also offering courage to someone else who may still be hesitant. 5. Treatment approach number 3. Surgery medication is one of the most common and effective treatments for most men with prostate enlargement. But sometimes medication doesn't bring the desired change. There are cases where nighttime urination persists, the feeling of incomplete emptying remains, and daily life starts to shrink because of one small gland growing larger inside the body. In these situations, surgical intervention becomes the necessary next step. And it's not as frightening as many people think. The most common and widely regarded gold standard procedure today is transurethral resection of the prostate, TURP. This procedure removes the part of the prostate pressing on the urethra, which significantly improves urine flow and reduces nighttime urination. According to multiple studies, TURP can reduce nighttime urination frequency by up to 32.2% in BPH patients. A major relief if you've been enduring sleepless nights. However, like all surgeries, TURP carries certain risks. About 20% of patients may experience complications, the most common being a sense of incomplete emptying, urinary incontinence, or retrograde ejaculation, where semen flows backward into the bladder instead of exiting the body. While not dangerous, these are side effects your doctor should discuss with you in detail before you decide on surgery. Beyond TURP, modern medicine has developed less invasive procedures with faster recovery times. These include laser surgeries like HoLEP or PVP, which use light energy to cut or vaporize prostate tissue. Another emerging option is aquablation, a technique that uses high-pressure water, guided by precise imaging, to remove excess tissue. Both methods have shown promising results in improving nighttime urination symptoms and reducing long-term complications. For patients, the most important thing isn't choosing the best procedure, it's choosing the right one for your condition and body. No two bodies are exactly alike, which is why consulting a specialist, based on diagnosis and close monitoring, is essential. Surgery isn't the finish line. It's a transition from passive to proactive, from enduring to recovering. And more than anything, it's a reminder that your body deserves to be cared for. whether you're in your 60s, 70s, or beyond. If you've ever considered surgery but still feel uncertain, leave a comment. I'm considering the option that's right for me. You might be the one who starts an important conversation for thousands of others going through the same thing. 6. The little tips few people notice. When it comes to frequent nighttime urination, we often think of medical conditions, medications, or major interventions like surgery. But sometimes it's the smallest, most everyday habits, ones we rarely pay attention to, that can make a surprising difference. That's why, after everything we've shared, I want to dedicate this final part to small tips that few people notice, yet can be incredibly helpful for anyone living with the condition of urinating many times in the night. The first tip may seem unrelated, but actually makes a noticeable impact: keeping your feet warm when you go to bed. Cold temperatures, especially in air-conditioned rooms or during seasonal changes, can irritate the bladder muscles, causing more frequent contractions and the urge to urinate. A pair of thin socks or a light blanket over your feet can sometimes be a gentle remedy for a peaceful sleep. Next is a simple habit many overlook. Go to the bathroom before bed, even if you don't feel the urge. This helps empty the bladder more completely, reduces overnight pressure, and lowers the chances of waking up. Many people say that this small change alone helped them cut down one middle-of-the-night trip. And for older adults, that one trip can make a big difference in achieving deeper sleep. Here's another small trick that's especially helpful for older adults, especially those with mild leg swelling. Elevate your legs in the afternoon. When we stand or sit for long periods, body fluids tend to accumulate in the legs. Once you lie down, that fluid gets reabsorbed and processed, leading to more urine production at night. Elevating your legs for about 30 to 60 minutes each afternoon can help reduce this effect and ease nighttime bladder pressure in a way you might not expect. And finally, a small step that's actually very important: keep a urination journal. Try recording how many times you urinate in a day, the exact times, and how much water you drink. This not only helps you better understand your body, but also provides valuable information to your doctor during checkups. Sometimes it's those specific numbers that help the doctor determine how serious the condition is and offer the most accurate treatment plan. Not every tip will work for everyone, but when combined with proper knowledge and medical care, you'll find that improving nighttime urination isn't such a distant goal after all. If you've ever tried one of these little tips and found it helpful, or you're ready to try one now, leave a comment. I'll start with the smallest step, because sometimes it's the simplest changes that bring the peaceful sleep you've been hoping for. We've been on a journey together, from sleepless nights caused by disrupted urination, to key understandings about prostate enlargement, and then to practical solutions, from lifestyle changes to medications to surgical options. And perhaps the most important message of this video isn't in the name of the condition, but in this: if you understand your body well, you'll always find a way to take charge of your life. Benign prostatic hyperplasia, BPH, is a common condition, especially in older adults. But that doesn't mean you have to silently endure it. With early detection, proper treatment, and a multifaceted approach, from daily habit changes to appropriate medications and modern medical interventions, you can absolutely manage frequent nighttime urination. Most importantly, you can reclaim your sleep, your peace of mind, and the rest you deserve. And if you're wondering, where should I begin? The answer is, start by taking your body seriously. If you find yourself frequently urinating at night, feeling like you never fully empty your bladder, or worrying every time you leave the house, don't wait. Visit a trusted healthcare provider. Ask about the IPSS questionnaire, prostate ultrasound, and other necessary diagnostic tests. Don't let small symptoms turn into bigger problems over time. Today's video isn't just a health story, it's a call for a new perspective, a chance to be more proactive, more caring toward your body. And if you've learned something useful today, leave a comment below. These helpful tips are wonderful to share your thoughts, and who knows, it might help someone else quietly searching for answers. If you know a friend or family member going through something similar, don't hesitate to share this video with them. And if you want to keep learning how to improve your sleep, take care of your prostate, or hear expert advice, choose the video now appearing on your screen, or click another suggested video from our channel. Thank you for spending your valuable time listening, reflecting, and being with us. Remember, restful sleep isn't a luxury. It's your right to live well each and every day. We'll see you again in our next video.